Hey everybody, this is Jonathan Waters at Elevate Wellness. I had made a video about a year ago on how to fix the knee lock problem that is oftentimes misdiagnosed as a meniscus tear requiring surgery, and how you can stabilize this thing within a few seconds oftentimes to fix it. Not 100% cure for 100% of people, but as the hundreds of responses have come through with, I think we're somewhere around 14,000 views. Clearly it helps a number of people, not just the hundreds I've seen over the years in my own coaching and with myself. I had not yet created a follow-up, and I wanted to make sure I do at least one now while I'm thinking of it. There are a lot of things you can do with banded work, with different pressures, oftentimes pulling the shin posteriorly, which is kind of weird to set up tethers for that. In some cases, you actually go the other way, so sort of pulling forward. It depends on what kind of instability the person is dealing with. And if you want a unique assessment, reach out to me through our website, elevatewellness.com, 8. But here is another trick on the follow-up that one can do and should do. And is you do want to get function where you can have full depth squats, lunges, twisting, turning, etc. So you have to introduce stressors in a strategic manner where you don't incite that, you don't trigger the inflammation, you don't fire it back up, you don't get a bunch of the snapping, and you still have that brace position, but you're building more density of tissue and more stability around the affected area, or potentially the affected area. So I oftentimes will use these risers. I don't know if they're in the frame. Hopefully the back end is, at least for box squats. And with some people who've actually had surgery, had tears, this almost always works. Similar methodology to the concept before, where one of these approaches seems to address a lot of the populace. And what you would start is, you'd start with a very high box, purposely high, obscenely high, with whatever loading can be managed in appropriate form, with glute activation, without the feet collapsing, without the knees adducting to the midline, and potentially, we can get into the particulars of that in the future. But you have a high box, you do basically a partial squat. And you want to get as much burning into the affected area as you can. That's a shuttle of growth factors in part that's going on there. And that's another thing I can update in the future, my experience with PRP, prolotherapy, stem cell therapies, and if that is indeed the final fix. For the meantime, on the movement side, you'd have the risers very high. Over time, you lower them, eventually flirting with the depth that triggered you beforehand, which by that time, let's say it's 10 weeks, 5 weeks, however long it takes you to get there, you'll hopefully have greater range of motion without the snapping. And eventually you will. What the time frame is going to be different from person to person. So for me, I can now generally go to the 2 risers. I may be able to go deeper, which is as deep as anatomically I can squat under load. Sometimes I have to actually accentuate the butt wing so as to diminish the amount of knee flexion that's occurring to avoid the snap. But let me just demonstrate real quickly that I can now do this without that snap you guys heard about a year ago. I could not do this. I couldn't even go to 4 or 5 risers without that snap about a year ago under load. Now 300-400 pounds even, I can get into this depth. I go with a slightly wider stance. This seems to brace my knee better. And silence, listen. Nothing. No pain, no snap, nowhere. No lock. Start real high, work your way down. It might take a little while. Be patient, but eventually you can pile the weight on here, squat to full depth without issue.